Ethionamide tablet is used in combination with other medications to help in the treatment of tuberculosis. It is an antibiotic that works by preventing the growth of bacteria in the body. It is important to note that this medication only treats bacterial infections and will not be effective against viral infections like the common cold or flu. It is crucial to use this medication only when it is prescribed by a healthcare professional, as unnecessary use can lead to it being ineffective for future infections. It is typically taken once a day, either with or without food, but it's best to follow the instructions of your doctor or pharmacist. When taking ethionamide tablets, it's important to follow your doctor's instructions carefully. You can take this medication with or without food, but if it upsets your stomach, try taking it with meals. Your doctor may also suggest splitting your daily dose into smaller doses to be taken throughout the day. The dosage will be determined based on your age, weight, medical condition, and how you respond to the treatment. For the best results, take this antibiotic at the same times every day. This will help you remember to take it regularly. It's crucial to continue taking this medication, along with any other TB medications, until the full prescribed amount is finished, even if your symptoms improve. Stopping the medication too early or skipping doses could cause the infection to return and make it harder to treat. Your doctor may recommend taking vitamin B6, pyridoxine, along with ethionamide to help prevent certain side effects, such as nerve problems. If your condition doesn't improve or gets worse, make sure to inform your doctor. Common side effects of taking ethionamide tablet may include nausea, vomiting, diarrhea, stomach pain, increased saliva, metallic taste in the mouth, loss of appetite, or mouth sores. If any of these effects persist or worsen, it's important to inform your doctor or pharmacist promptly. Although some people may experience serious side effects while taking this medication, it's important to remember that your doctor has prescribed it because they believe the benefits outweigh the risks. Your doctor will closely monitor you to decrease the risk of serious side effects. Be sure to notify your doctor immediately if you experience any serious side effects, such as persistent nausea or vomiting, unusual hunger, excessive sweating, shakiness, extreme fatigue, yellowing of the eyes or skin, dark urine, joint pain or swelling, slow heartbeat, changes in mental or mood state, vision changes, eye pain, or numbness or tingling in the arms or legs. While it is rare, a serious allergic reaction to this drug may occur. Seek immediate medical help if you experience symptoms such as persistent fever, new or worsening swelling of the lymph nodes, rash, itching or swelling of the face, tongue, or throat, severe dizziness, or difficulty breathing. This is not an exhaustive list of potential side effects. If you notice any other effects not mentioned, it's important to contact your doctor or pharmacist for further guidance. Before taking ethionamide, make sure to tell your doctor or pharmacist about any allergies you may have. This medication may contain inactive ingredients that could cause allergic reactions. It's important to also inform your doctor about your medical history, especially if you have liver disease, kidney disease, underactive thyroid, or eye problems. Avoid consuming alcohol while taking ethionamide, as it may increase the risk of liver disease or mental/mood changes. It's also important to let your healthcare professional know that you are taking ethionamide before receiving any live bacterial vaccines, such as the typhoid vaccine. If you have diabetes, ethionamide may lower your blood sugar, so be sure to monitor it regularly and report any symptoms of low blood sugar to your doctor. Additionally, if you are pregnant or planning to become pregnant, discuss the risks and benefits of using ethionamide with your doctor. It is also important to consult your doctor before breastfeeding while taking this medication. When taking ethionamide tablets, it's important to be aware of potential drug interactions that could affect how the medication works or increase the risk of serious side effects. It's essential to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share it with your doctor and pharmacist. It's important not to start, stop, or change the dosage of any medicines without your doctor's approval. This will help ensure the effectiveness and safety of your treatment. If someone has taken too much ethionamide and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help by calling 911 or a poison control center. In the U.S., residents can call their local poison control center at 1-800-222-1222, while Canadian residents can call a provincial poison control center. It is important to take this medication only as prescribed by your doctor. Do not share it with others. Your doctor may also require you to undergo certain medical tests while taking this medication, such as sputum tests, eye or vision exams, liver or thyroid function tests, blood glucose tests, and complete blood counts. It is important to keep all your medical and lab appointments and consult your doctor for more details. When taking ethionamide tablet, it is crucial to adhere to the prescribed schedule. If you happen to miss a dose, take it as soon as you remember. However, if it is close to the time for your next dose, it is best to skip the missed dose and continue with your regular schedule. It is important not to take a double dose to make up for the missed one. As for the daily dosage and optimal timing, it is best to follow the instructions provided by your healthcare provider. They will be able to determine the best dosage for you and the optimal time to take it. When storing ethionamide tablet, make sure to keep it at room temperature and away from light and moisture. It's important not to store it in the bathroom and to keep it out of reach of children and pets. When it comes to disposing of the medication, do not flush it down the toilet or pour it into a drain unless specifically instructed to do so. Instead, properly discard the product when it is expired or no longer needed. It's best to consult your pharmacist or local waste disposal company for the proper way to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.